It's difficult to describe what's happening in the Western world these days with COVID. And many people have thought long and hard, including myself, and I'm sure all of you, about just what is happening. And during this time, one of the phrases that came to my mind, and I think properly describes what we're seeing, it's not a term that I use very often anymore. It's not a term any of us use very often anymore, but it's counterfeit. Now, we often think of counterfeiting when it comes to currency, dollar bills. But one of the aspects of counterfeit or counterfeiting is those replicas look so much like the original. For most people, they're accepted as the real thing. And I think it's a good term to start thinking about COVID. We know it's a virus, but is it what we think it is? Is it what we were told it is? And I think if you go through this and start unpacking what we do know as compared to what we believe we know, that term plays an ever bigger role. So let's just start. Back in March, when we were told that this was probably the greatest threat to mankind, the greatest contagion, the greatest, most catastrophic virus mankind has ever met with. We were told it would strike everybody, regardless of age, regardless of health, regardless of anything. Everybody was at risk, and a high risk, to COVID. But of course, we now know that's not quite true. That if you're elderly, if you're ill, if you have chronic illnesses, if you're obese, those are all things that increase the level of risk. And as you go through these things, there's a common element. All the things that we were told to be fearful of in the early days, nobody has really come out to tell you the new facts. Governments haven't done it. Public health organizations haven't come out to do it. The media hasn't come out. They've been all pretty silent about the new information. They were all very big proponents of the initial fears, but there's been a hesitation and a reluctance by all these institutions to put the correction in the newspaper. And when they have put the correction in, it's pretty small and doesn't take much space. One of the other big things that they told us is that the infection fatality rate was going to be astronomical. The numbers that the CDC and the WHO put out was the infection fatality rate was 3.4. The WHO last week, October 3rd, put out a new figure. And the new figure is 0.13. It means 1 in 750 infections would die. But the WHO released that number last Friday. I have yet to see it reported on by any mainstream media. I have yet to see any Western government grab hold of that new data and modify or even talk about altering their lockdown policies and their restrictions or testing. And testing brings us to another interesting element of COVID and why I think counterfeit is a good term. So we know that the PCR test is being used. We also know now that the most prestigious and eminent scientists in the world have indicated that the PCR test will provide between 50 and 90% false positives. Indeed, Michael Yeadon, Dr. Michael Yeadon, former executive at Pfizer, has stated that most, if not all, positive tests are false. But all Western societies are continuing to ramp up PCR testing, knowing that they produce false positives. This PCR test was not ever even designed to test for viruses. And now we've coupled it with an extraordinary defect in the testing of using far too many cycle thresholds that produce more defective results. We could go on, and I think we should go on. Let's look back in March when they told us that the transmission of COVID could be by any means, in anywhere, anytime. You could be infected with COVID if you touched a desk, a piece of paper, a tomato in the grocery store, that this virus lived on surfaces. This was a super virus. It could do things that no other virus had ever been known to be able to do. Of course, we now know that that's not quite true, that the transmission of COVID is by droplets and by aerosols, not by contact and not by touching. Even the esteemed physician here in Kingston, Ontario, came out in May and stated you need to have prolonged exposure in a confined facility with somebody who is infected. Has the media gone out and told people about this? No, they haven't. Have our governments gone out and told people that you can't, the likelihood of contracting the virus from touch is exceptionally unlikely? No, they haven't. And that's why you still see people wiping down their food in the grocery stores, wiping down the conveyor belts, wiping down and sanitizing everything, even though we know it's spread by aerosols and droplets. And that takes us back to, like we all remember back in March and April, when we were told that masks were not any effective means to prevent the transmission. And that was stated quite clearly by every recognized public health organization, the WHO, in Canada, Dr. Tam, in every province. Masks were no protection for you. And of course, now it's mandatory for people in Canada, in most places in Canada, many places in the Western world, that you must wear a mask indoors, even when in casual walk-bys. Even the city of Kingston has even gone so far as to make social distancing and mandatory masks outside in their downtown core. When we absolutely know that the likelihood of transmission in those sorts of environments is zero. What have we done? Why have we not explained the facts as well as we explain the fears? Because we're not explaining the facts today to people. We're leaving many people in a high state of anxiety, a high state of fear, because we're not communicating to them what we now know. Be sure to like my video, share my page, take your friends, and follow along as we work together to get out of the mess that our governments have gotten us into with COVID.